We move on next here tonight to what local doctors are now watching out for, the RSV virus. And new here tonight, Mary O'Connell with a message from one parent whose son is sick in the hospital right now.
Parents never want to see their child under the weather. That's true, too, for Paula Marcel and her 3-year-old son, Hunter.
My son kind of already has a lot of predispositions to, immuno problems. He has a trach and stuff like that. So we actually had a nurse that was over at our house, and she noticed that he was just not really acting like himself.
Then she noticed even more was off.
He looked like he was kind of like shoulder shrugging and just looking like he's working really hard to breathe.
He's in the hospital right now with RSV, something that's spreading through the community. In fact, according to Hopkins All Children's, last month, 105 pediatric patients tested positive for RSV at their hospital.
We have for several weeks seen an increase in the number of kids who come into the emergency center with RSV infection, maybe 4 times higher than it was just a month ago.
I spoke to Dr. Juan Dumois with All Children's. He said RSV is very common, but it can be a big problem for young children.
I can get RSV too, but I'll have congestion and I'll have increased mucus in my lungs, but I can usually handle it better. A tiny baby who gets RSV, that same degree of inflammation and mucus production in the airways and in the lungs can totally obstruct the airways.
Symptoms can include coughing, fever, runny nose, and sneezing. The American Academy of Pediatrics says it recommends a single dose of a new preventative antibody for infants younger than 8 months born during or going into their first RSV season, and infants and children 8 through 19 months who are at an increased risk of severe RSV disease and going into their second RSV season.
Today he's still kind of in the worst phases of it. RSV is kind of one of those things that tends to get a little bit worse before it gets better.
And this mom hopes her son starts feeling better as soon as possible. In St. Pete, Mary O'Connell, ABC Action News.